and thank you for coming, everybody. We all work with bioluminescent bacterial biosensors, and you are sitting there at tables with some plates, plastic plates on, which contain bioluminescent bacteria. There are a few examples of bioluminescence that occur terrestrially, like glowworms, which some of you might have been lucky enough to see, and fireflies, lovely, and bioluminescent mushrooms in tropical forests. And they all do a similar thing inside their bodies to your glow sticks. They mix two chemicals that give out light, and we can put them into whatever bacteria we want to put them in. So this is genetic engineering. So we are genetic engineers. Now, this is something in a social context that you may be interested in and you may want to ask us more about. But genetic engineering in bacteria, I have to say, from a sort of ethical point of view, we're quite fortunate. Nobody minds if you kill lots of bacteria to extract their DNA. And it's also very easy to do.
Well, these processes are powered by the bacterial metabolism. They're directly coupled to the metabolic rate of the bacteria. So we only actually get light emitted when the bacteria are alive, when they're metabolically active, and when they've got oxygen available as well. Traditional microbiology is always going to be used for testing the kinds of disinfectants you've got on the tables in front of you. And it will tell you essentially how good those disinfectants are over pretty well-defined time periods. But what we can use glowing bacteria for is actually to look really closely about how quickly those disinfectants are able to kill bacteria. And we obviously moved on since then. So bacteria can respond to lots and lots of stimuli. They will, in some cases, put out more light when they are happy, when they've got lots of nutrients. When we're killing them, the lights might go out. And they might respond to different chemicals with either a pulse of light or the lights going down. Part of the research I did was with a novel disinfectant we've been involved in developing at the university, and it turned out that the disinfectant was incredibly fast-acting, so much so that the traditional tests were relatively useless.
The premise behind this is using those bioluminescent bacteria that you've just heard about to predict how patients are going to respond to chemotherapy in advance. People aren't happy to just undergo treatment based on a statistic. They want to know what's actually going to happen to them in advance, and why wouldn't you? You're putting these incredibly toxic chemicals into your body. You want to know what chance you've got of them actually doing something. And this could lead to tailored treatment for individual patients. So the actual disease that we work on is called acute myeloid leukemia. It's a specific type of leukemia that occurs predominantly in the elderly. If you could identify that an 85-year-old person was incredibly sensitive to the drug, you could give them a lower dose, a tenth of the dose that someone younger would get. And it won't probably cure them, but it may give them good quality of life and just maintain and restrain their disease to give them 6 months or a year, potentially. And this is something that clinicians are trying blind. You know, they're trialing whether they can just give people lower dose. But it would be great to cherry pick people. And similar cases where if someone's really resistant, do you really want to put yourself through 6 weeks of this treatment if you know you're only going to end up on the relapse treatment anyway? Why don't you just go straight for the more stringent drugs? And there's loads of cases where younger people, particularly women of fertile age, may want to consider this kind of thing and have more information about, do I have to go for the chemotherapy now? This will add to what is currently done in terms of genotyping, characterising individual people's severity of disease. This will give them their individual chemosensitivity profile, and the clinician has loads more information to go on then than they do at the moment. I think if we go have a look, and then what we're going to do is actually apply some of these different things. And I want you to get up and go and try each other's products. I've deliberately only given you a few. So you should be able to get 7 or 8 different products on a plate. So those plates in front of you, we'll come and give you a plate each. So if everyone wants to come to the bug booth, we can get maybe 3 adults, 4 children, 3 adults.
The table's quite small, isn't it? You get 3,
yeah.
3 in a demonstrator, probably.
Yeah, we have now invested in a bigger bug booth, it just hasn't come yet.